Hey guys, I'm Jake, and welcome to Kings and Queens of Miniature Castles. Hey everyone, welcome back to another episode. Today with me we have Paul Fisher, who is a physical therapist here in the La Crosse area. Paul, you've been doing this for, you said, 26 years now?
Yeah, I think this will be my 27th year at the end of the year.
Okay. So tell us more about yourself. How did you get started? What are you doing now?
Well, getting started into physical therapy was a little bit of a high school process of meeting physical therapists, having friends going through therapy for torn ligaments and injuries, and developing an interest in helping others. I think that physical therapy matched what I thought I wanted to do with my time, and it was definitely an industry that I got to be working with people, which I enjoyed, and helping them with their injuries.
Okay. And then back when you were in undergrad or going to school for this, it was a 4-year program?
Yeah, physical therapy has transitioned over the years from a 4-year bachelor and then to a master's program. And then now it's a doctoral level program.
Okay. How does that look in terms of someone who just graduated now with their doctorate in physical therapy versus what you've done for education and continued education over the years?
Well, coming out of school, it's very similar. You have a wealth of knowledge and a very small amount of practical clinical experience, and you're trying to meld those two things together as you grow into the profession. Doctoral level physical therapy has spent more time in the classroom and studied some areas that weren't covered in earlier years. So they're coming out with a different level of understanding. For those who have been in the profession a long time, some of these new teachings, new learnings, and radiology and pharmacology, those are things that you would go out and get additional education through continuing ed courses, if that's something you want to pursue.
Okay. Okay, so you've been doing this for over 25 years now. Have you seen any changes in the career outside of it becoming a doctorate program now? Have you seen any changes with working within the hospital system, the type of patients that you see, that kind of thing?
Oh, absolutely. The medical field is always advancing and changing. A big push within the physical therapy community has been to have, a wealth of information behind any of the, actions or the treatments that we're going to offer, and do our best to have some kind of scientific basis to, show that this is an effective way to do things. And that push has driven maybe some of the things that we used to do to maybe the back burner, and has brought to the front of the burners, if you would, some different types of approaches to dealing with, chronic injury or acute injury. Even there's a lot of change that kind of just continually happens.
Mm, okay. Um, and with those changes, have you found it fairly easy to adjust and adapt, or have there been some like sticky points?
Oh, I think you know it's definitely difficult at times because there have been, after 27 years, you've seen some fads grow up, and then turns out those fads didn't amount to much. So as new things come into the profession, we're kind of naturally skeptics of new things unless we see some type of evidence to support it. But it definitely is always refreshing to have a new approach to try with somebody. And many of these approaches that are being brought forward now have that backing, and you have a much higher degree of confidence to tell someone this is going to work to a 70%, 80% uh, improvement rate for most people, and that's really important for people to hear that because they need something to kind of anticipate, and that kind of confidence is an important part of treatment too.
Yep, sure. Yeah, just need that confidence boost. Could you tell us about some of the fads that you've seen over the years?
Oh gosh, yeah. I don't want to get in trouble because some people still really like to use some of the different methodologies that maybe didn't prove themselves out, and I do think there is a element in physical therapy, what you'd call, maybe we would call eclectic treatment, that has some creativity to it, and maybe some people respond better to that, and it's hard to put a scientific study to support it. But some of the different taping techniques, or some of the different um, ways that we have approached um, maybe ligamentous injury, um, moving people sooner and faster. We used to give big healthy portions of rest for many different injuries that we now know respond better to being active sooner, and even something as simple as stretching muscles. We believe firmly in sometimes stretching is a good thing, but not always. Sometimes it's active warm-ups and things like that, and this has been in many of the other disciplines too, sports medicine and athletic training. They're recognizing these some of these different things as well. But I do think that the profession of physical therapy has uh, long been a leader in pushing for a scientific approach to these things.
How does that look? Yeah, with you have physical therapy, you have sports medicine, athletic trainers, even like you can throw chiropractors kind of into that mix. How are they all working together for that holistic health, and where do they differ?
Well, I think they all have a very important role in healthcare. Some of them offer a stronger presence on certain types of tools. I think people, when they think of chiropractic, they think of manipulations and, cracking the bones. And that certainly is a tool that they use, but, chiropractors also focus on diet and health, and so do physical therapists now. They consider these types of nutritional needs, and athletic training, and sports medicine concepts are sometimes we overlap. I do think that the history of physical therapy produces a very strong evaluation um, and scientific based methodology to the different tests that we use. They have a very strong history in that. So we offer a very medical approach to those things, and um, documenting it in a way that allows someone else to come along and understand exactly what's going on with the patients that we're working with.
So, would you say you have somewhat of a holistic approach, or more of uh, for the most part, just working on the specific injury at the time?
Well, I think each physical therapy um, practitioner is going to have a slightly different focus, somewhat depending on the profession or the area that they're working in. I work in a hospital. I'm hospital based, so I'm very focused on the interdisciplinary concept of care, where nursing and dietary and doctors and nurses are all intertwined. Respiratory therapy, together with the treatment of a patient, often communicating, you know, throughout the day on what they're seeing. In the outpatient setting, I do think physical therapy can be focused a little bit more on a specific injury. I think that it is up to the practitioner to ask a broad range of questions to attempt to pull in the holistic nature of things. And I do see that there is much more stronger subjective questioning on these things, that would include, finding out, what is the patient already currently doing in other areas so that we're aware of the things that they like
Yeah.
to try to do.
Before we go too much further here, can you just give us a brief look into what you actually do as a physical therapist? What does that entail?
So right now, I've been practicing in a hospital. So I'm seeing people that are coming in maybe through the emergency room with injuries, car accidents, or just having fun injuries. Sick people that have medical problems, sick people that have cancer or things that are not allowing them to be at their home. My primary focus is facilitating those people back into an activity level that would allow them to get home as fast as possible. Sometimes that means that we recommend them to go somewhere for more therapy after they leave the hospital, which is sometimes challenging, as you can imagine. Some people just want to get home, that's their main focus. But if they're truly not safe and we can counsel them to get some additional therapy before going home, it's sometimes actually a faster way of getting home versus going home and falling and getting injured and coming back again.
So there's hospital-based physical therapy. What are the other types, or like what are the other locations that you can go to?
There are quite a few different areas physical therapists practice in. Um, they might practice in a school setting with kids that are needing physical therapy training because they have a development issue. You might see physical therapists working in, of course, sports medicine is the one that many people think of. We also are helping out in nursing homes. Physical therapists take their skills sometimes to a corporate level. I would say even like in our town in Lacrosse, Quick Trip has a physical therapist hired on their staff and working with their employees. And that's a model that's sometimes is used in maybe larger corporations. Physical therapists will obviously do private practice and have their own clinic. Sometimes they will get in tandem with chiropractors or, like you said, talk about holistic. There are holistic clinics in our area. I'm not as familiar, but where you might have a chiropractor, a physical therapist, a massage therapist, and
All kind of bundled up in
all
the same
all
area.
yeah, all kind of working together, and they kind of refer patients back and forth to the different skill sets so that all the different tools that the different practitioners might employ would be available under the same roof.
And even like when I hear that, like my first thought is like that seems a little scammy, but at the same time, like I recognize that there's like each one once again has their own specific niche, and like the more I talk to my friends who are athletic trainers or who are going to school, like the more I realize that the body is so interconnected, and everything's just affecting everything. So I guess yeah, it makes sense that they should have these groups all kind of working together for the health of their patients. One of the places that you're mentioning you work in is the emergency room. What does that look like?
Sure, that's a newer venture for myself and some of the therapists at our hospital, but there's a recognized need to have our services available to people that have certain types of conditions coming into the emergency room. A big area that we treat is vestibular um, problems. Largely, we're looking for a specific niche of vestibular problems, positional vertigo. And we have some pretty specific treatments that can be effective immediately and completely eliminate someone's vertigo if it's a positional type of vertigo. But then we also can help the doctor understand, if it's not that, the other things that we're seeing might help guide their treatment.
For those of us who don't know, mostly myself, what is vestibular problem?
Sure. To answer your question about, what is vestibular, your vestibular system is a system that your brain uses to kind of understand where you are at in space and how your body's moving, through space. A big part of this is your semicircular canals, which are part of your inner ear, or the part of the ear that's kind of deeper, almost, in the skull. Um, it's a system that has hoops that communicate with a central hub, if you would. And when you turn your head right, left, up, or down, these different canals will signal to your brain which direction you're moving. Kind of almost probably like a Wii controller can tell which direction your Wii controller is moving. Your brain will get feedback from these loops. You can get a little bit of sediment inside of these loops, and it can throw off the communication between your inner ear with your brain. And when you have your right ear and your left ear telling your brain two different stories and it doesn't line up, you begin to get a very swirly, horrible feeling like the room is moving, or that you're moving, and it can be very nauseating and make you sick.
Okay, so that's what can bring about then the vertigo.
That's what brings about the vertigo. And there's certain tests that we can do to determine, a highly skilled vestibular therapist can tell you actually which hoop is being bothered based on how they move you and how your eye movements are. And they're looking for some specific actions and reactions in order to determine how to best try to clear that tube out so that it's functioning properly.
Is that a specific field, a vestibular therapist?
No, it's something that, once you're a therapist, you may choose to go get a certification and go through some extra coursework to have a certificate that would said you're a certified vestibular therapist. But by and large, individuals coming out of school now will have had enough coursework and gain the experience that they might need to start practicing uh, with those patients.
Gotcha. Okay. I was gonna say that'd be so niche to be able to specifically be a therapist for that type of thing.
Yeah,
But
if you go out and YouTube positional vertigo and watch how people react to some of these tests, it would be kind of an interesting thing because people don't realize that this kind of stuff can happen. But that's one area we do engage in the emergency room, because if you can imagine being able to be treated and have your symptoms go away pretty quickly, um, you definitely want to do that versus walk away from the hospital and have to wait to get into the clinic or something. So we're doing our best to meet those people where they're at. We also are seeing people, maybe with falling issues, or things that we try to keep them out of the hospital. That is more of a physical therapy problem. But they can't go home with some training in the emergency room and maybe get them a piece of equipment, a cane or a walker, and send them straight home and keep them out of the hospital. It's much appreciated.
gotcha. With kind of delving into this new part, do you feel like both your years in college and all of your continued education kind of prepared you for it, or is it kind of figuring out stuff as you go along?
It's interesting because you can have all the head knowledge, but then you get in front of a patient and they don't meet every continuing education textbook. They don't
Yeah.
they don't follow the rules. So you have to make clinical judgments based on best available evidence, the test that you're seeing in front of you. Sometimes it's even the personality of the patient drives your decision making. Will they receive this well, or are they too anxious about trying something that physical therapy might be able to offer? So the treatment ultimately is a combination of all of those things: the learning that you do, the clinical experience that you gain, and then even your interaction with the patient. If it's a real positive and you guys are working well together, it'll probably have a better outcome than if someone's skeptical or nervous to try something. And so it's an interesting question that you ask that, but it's not a real straightforward answer. But I do think the more continuing education you get, obviously,
Yeah.
the more knowledge you have to work with in those situations.
And then speaking of education, in that timeline, especially with the core classes and the core class loads that you had to take, do you feel like they all set you up pretty well for what you had to start doing, or were there a lot of them that you kind of that were unnecessary even in the core stuff?
When I think back to what I learned, I think every bit of information that I gained was helpful. And to some extent, I feel like there are opportunities for me to know more. But because I did not have the clinical experience, maybe I didn't focus on some of that information as it was coming to me because it didn't seem as relevant. But now that I've practiced longer, I see more relevance in the education, if that makes sense.
What makes for a good physical therapist, and what makes for an exceptional physical therapist?
We're all exceptional.
That's what we like to hear. That is the only kind of answer we want to hear.
Oh, I think that that's a interesting question. I think that it's kind of like keeping everything even as you improve and go. I do find myself at times not keeping up in some areas and advancing more in others. And I think keeping a very well rounded balance between focus on the practice and focus on the head knowledge. I do think, exceptional physical therapist is the one that keeps up with all of the data as it's coming out, and it can be tough to do. And there's so much that you could know. I do think that physical therapy is getting more niche, if you would. It's almost like even in the medical community with doctors, you're probably have less general practitioners and more specialists, and people are getting into specialties faster because a doctor just can't know everything, and there's so much to know. And even within physical therapy, we talked about the vestibular area. It does seem that within a clinic, therapist gets known for their vestibular work, and then they kind of like doing it, and the next thing you know, that's 80% of their caseload. So we do tend to get pigeonholed into certain areas that maybe either we're great at or maybe we just really like. But I do think if you don't like it, you're not going to be great at it.
Yeah.
So I think you tend to drift towards that which you enjoy and like. And there's just so many opportunities. And if you get tired with one area, that's a great thing about physical therapy. You can totally take a different focus and say, hey, I want to be better at treating necks and shoulders, and send those evals my way, and I'm
Mhm.
going to get some training on different techniques and expand my horizons in that area. It's pretty fun.
Is there the hospital that you're currently working at? Does it provide like ways for you to be able to pick up different specialties?
Oh, absolutely. I mean, we're given opportunities to maybe pick an area that we want to advance in, and we talk about it with our managers, and kind of look around the system and see, well, is there someone else that already has this specialty? Can I learn from them, or do I need to go off to continuing education? And we're very collaborative, and within our system right now, we're working on clinical practice guidelines, and we're making an attempt to learn from each other and study these practice guidelines so that we have a better understanding of what has already been put out there for guidelines for specific problems, and then between each other study something specifically and take what we've learned and share it back to the group. And it's a very collaborative environment, and you can take that as far as you want, or um, as minimal as you want. The state requires you get a certain number of hours in, every year, and different activities will count for different types of learnings. And so, yeah, you always got to keep up with it, and it's enjoyable when you find an area that you really are curious about.
Okay. Yeah, I know with my parents as pharmacists, they had a lot of continued education, but the majority of that just looked like taking classes on just pharmacology. And I took a couple of peeks, and I think that's what that it's kind of scared me away from anything to do with that field, for sure.
it's
Uh,
definitely it's definitely a very heady field that requires a lot of understanding of chemistry and biochemistry, and
hmm
physical therapy has some elements of that in the core curriculum before you get into physical therapy school. You have to take some of those microbiology and statistics and some of these chemistry classes that would help you in the pharmacology world, and then in the physical therapy doctorate programs, there is more of that, but definitely not the level of a pharmacist like your parents would be.
Um, so now I really want to ask, right? Like, where would you consider yourself in the good to extraordinary line? But I feel like I won't get an honest answer out of you. So how I'm gonna phrase it is what what makes you hireable when it comes to a hospital looking to hire on a physical therapist? What makes you specifically stand out?
Well, that's a really good question. I think experience when you're dealing with sick and acute people is a very important part of how to not only connect with people who are in a bad situation, but to gain their trust, and to read their situation. I think what makes me good at what I do, um, is that I can read patients. I think pretty quickly, and understand if this is somebody that needs more um, physical therapy, or if this someone needs more just encouragement, psychosocial support,
Mm,
confidence. There's a great deal of, um, if you think things are doom and gloom for yourself, you tend to perform more poorly. And we see that in any kind of job situation, on the sports field, but it also bleeds over into trying to get out of a hospital if someone's depressed. And queuing into those things and bringing in other professions, collaborating with other people, or sometimes just listening. And I think that the ability of myself and all my coworkers are just absolutely exceptional in this area too. Just to listen to a patient and hear sometimes the grief that they have over the loss that they're experiencing,
mm,
or the loss of dreams or things they hope to do, and then to try to give them some element of hope of saying, hey, but let's try to accomplish that, but maybe you can't do it the way you wanted, and give them some kind of hope to look forward to. And I think that that's an area that I do a good job in, and motivate people to keep trying and to get going. So that's my strength.
okay. I feel like it can be so cynical to say, what makes you hireable, but I think it's important to, yeah, know our strengths, know what we're actually excelling at, and if that's something that we enjoy as well, like that's when you're really been blessed. So that's exciting to see. So you're talking about, providing hope, and a potential future for a lot of your patients. How, not how, but what are some cases that you've seen that have given you hope or have just been really tough?
I can think of a young man that came through with a stroke, and you can imagine, you think of strokes as being an older person's problem, and they worked with him at a different facility, and I can be sometimes aggressive with some of the stroke patients, um, and kind of focus on helping them understand what's going on in their body. This man was told he probably wouldn't walk again
Mm,
because of where his stroke was. And I told him that I didn't believe that. And I told him I think I could help him get better, maybe not walk as good as he wants. And he trusted me, he believed in me. And we did some really hard exercises and put him in situations that, you know, he had to struggle with. And after coming into our facility and working with me, he was able to eventually walk out of the hospital. And
okay.
that was very well encouraging to me because I was telling him I thought we could accomplish these things together. Um, I believed it, but I wasn't really sure.
Gotcha.
And sometimes you do that. You make this kind of like hope and promise. I think we can accomplish this, not really knowing if you can or not.
Mhm.
But it was really collaborative between the two of us. Um, and I bumped into him. He was still working with the outpatient therapist, and he walked up to me and gave me the biggest hug and thanked me. And just that was probably a point that really I would. It's probably one of those things I'll think back on for years and years and years because he was so upset and frustrated when he came into our facility, and he walked out with some abilities that he was told he would not have, and it really was a matter of learning how to work with his body and slowing down, and it was probably some physical therapy, but some of it was really just a spoken word of encouragement and helping him to focus on what he can do and focus on those aspects of what he can do well and accentuate that further.
Yeah. Plus, I'm sure like a lot of it had to do with what he was willing to bring forth to the table too,
Oh,
right?
absolutely. Yeah. I mean, it's not every patient interaction, no matter what profession you're in, there is a bilateral trust between the practitioner and the patient that impacts the ultimate outcome. And if there's not a good interaction between those two, I don't think you'll achieve the optimum outcome.
Mhm. Along with that, you have some great stories with that. I'm sure you have some tough stories too, where it's not everything that didn't go their way. Um, with having all those experiences, and also just with how your hospital specifically has you rotated, where it's what 7 days on, 7 days off
Well, yeah,
situation.
we had some problems, getting weekend coverage. People like their weekends off, so that was a suggestion put forth by myself and another person. So yeah, I've got a very big privilege in that, and but there's some drawbacks. Every other holiday I work, every other weekend I work. There's some sacrifice with it, but it provides a lot of continuity of care in through the weekends for patients where we used to have maybe a complete drop off or the communication wasn't able to be carried forward as well to the other staff working the weekend,
Mm.
and just that understanding of the different patient needs going into weekends and whatnot. I think it provided that. Uh, so it's been a real positive thing, I believe, for the hospital, and it's
Okay.
also taken a burden off of other therapists that normally would have been covering the weekends. So they appreciate that.
What kind of toll does that take on you, and like how do
Right.
you
Right.
combat it?
How do you combat that? I don't. I think it goes both ways, right? I mean, sometimes it energizes you, and sometimes it kind of saps you, and it's you don't really know what kind of week you're going to get till you get into it, and you start interacting with people, and maybe the patients are doing really great, but then maybe you're not having the best interactions with somebody else, and there can be a lot of stress in the hospital system. We have a big team of people, um, and really, post COVID, it's interesting. We've had a much harder time of helping people get located into a short term or long term care need where they need some additional therapy or some additional support from the nursing community, like in a nursing home or a step down facility that could care for them. Um, and it becomes a stressful environment where we're all trying to help someone get out of the hospital, but we just can't get them anywhere. And you have a sense of pressure from you know the system to try to keep moving people through and not let people get stuck in the hospital. Um, so it can be emotionally difficult. Patients are frustrated, nothing's happening. Maybe they just want to go home now and they don't want to go get the help that everyone thinks they need, and you've got them talked into doing this additional care, and they're getting disenfranchised with the process of
Mhm.
just getting out of the hospital. So those things weigh into that. Typically you have people that are energized by those types of interactions, right? Like you're energized by the talking with people, and then other people that kind of really just drains them the whole time. And I think that's that. Maybe it's an introvert extrovert type of a thing, but I tend to be typically energized with the interactions with people, and
Okay.
so I don't necessarily come away emotionally drained too often, except for when you don't see the outcome or it doesn't work out for someone so good, and they get some bad news, and that's hard to hear, and I would say a lot of healthcare workers, the nurses and the doctors, experienced a lot of that through the COVID crisis, and
Mm.
seeing the not good outcomes. And I still think there's some post strain within our whole community. If you talk about holistic types of things, if you think of our hospital system as being a whole body, you know, our whole body has you know bruises and bumps and lumps from coming through that.
Mm.
And I still think there's some healing that's occurring, and some people are burnt out to the point where they can't wait for their retirement dates. And there's people that are just coming in and coming into professionals that you know that used to be bubbly and excited to train them are a little more cynical, and it's just we're just kind of coming out of it. And I see more and more light coming through right now. But it's been a tough 2 years.
I'm sure, yeah. I'm sure there's also a huge shortage of workers all around within the hospitals. But yeah, can you talk more into like how COVID affected both your workplace and just um, how you got to work with patients and all of that?
Sure. Well, being in the hospital, I'd be working with COVID patients directly, but it's kind of a frontier that nobody really knew. You're practicing um, with patients where you don't have best available evidence, because the evidence is right in front of you and there's nothing to reflect back to.
Yeah.
And if you could imagine, we're all talking, well, do we move this patient more? Do we move them less? Do they need, and the doctors are trying to figure out, do they need more of this type of medication or less? And then you have the whole outside world having their discussion about what's best or what's not best. And um, to some extent, the practitioners kind of could be caught in the middle a little bit of the fire. And I think um, for me specifically, it was um, interesting because in the beginning, they really shut everything down, and it got real quiet. And we had all kinds of workers, but no patients in the hospital.
Mm.
And then as it started going more, it really ramped up. And then we had all kinds of patients. And honestly, I think we had all kinds of people helping too. I don't think we felt extremely short in the midst of it. Um, but then as we got through to the end of it, people were getting burnt out, and it seemed like there were less people available to work, or they were getting sick. Definitely impacted me. I think I've definitely feel more um, humbled at what I can actually practically do for some people. Whereas certain conditions, before COVID, you really felt like you made an impact on helping someone get back on their feet, but
Yeah.
you felt very helpless at times with this COVID thing. The virus kind of did what it did in some people's bodies and not in others. You saw some people just refuse to let the thing beat them, and they miraculously pulled through. And you saw other people that you thought would do great. They couldn't do it. They didn't have the energy, and they didn't make it out of it. And that was hard to watch.
Yeah, it's crazy to think that, it's been almost 2 years since the onset of COVID, a little less since it started affecting lacrosse. Um, but yeah, even now, like just feeling the after effects of it in so many different jobs, so many different vocations from a lot of my friends. I just remember well, I think one of the weird misconceptions about that people have when it comes to healthcare, um, is that everything, like what works for one person or what they heard works for their friend should work for them. Even though I'm sure they have countless stories of like we had to go and get a third view, a fourth view from different people trying to figure out what's happening. But at the end of the day, their first thought is that what worked for someone else should work for them. But that's never usually the case, is it?
Um, you know, that's an interesting point. I think that's true. But sometimes you might think that, but maybe they're doing two totally different things. Maybe the treatment would work the same for each of them, but when they go home, maybe one of them sleeps in a funny position and they're actually causing damage to their injury all night long and they don't even know it.
Mm.
So, that's where coming down to asking really good questions and, you know, there's a thing going around right now. We're talking about sleep hygiene, and I think that that's a big part that I've noticed over the years and have discussed with, my colleagues and have discussed with, patients that I've worked with is, you know, when you wake up in the morning, are you worse? Are you better? If you're doing something wrong all night long, you think about if you're sleeping for 8 hours, if you're in a position that's contributing to your injury for 8 hours, um, that's a lot of your day. So I do think there's things called sleep injuries that sometimes get overlooked or underappreciated.
Hmm. That puts me in mind of the next part of the show where we look at the stereotypes of your job. What would you say are some misconceptions that the community has, and where do you think they're coming from?
Well, I think some patients are coming from experience. They had a negative experience. So going to the store, you have a different experience if one person's behind the cash register versus someone else. And I think that's difficult for people to wrap their minds around. If you go and have a bad experience at a dentist or with a physical therapist, you might assume that all of them are going to treat you the same.
Mm.
And so that's definitely a misconception. Also, a misconception on landing on a treatment plan. You know, I can be sitting next to somebody in the clinic and we can come up with two different ideas on the treatment plan. Neither of them necessarily would be wrong, um, but both of them could, end at the same point, which is improvement or corrective. So we're not quite to a point where we have a clear path on every diagnosis type. So you do have a variation of approaches. So I do think that that's a um, maybe a stereotype that could be like, oh, they don't always know what they're talking about because this one said this and this one said that. That can happen, but the concepts of care might both be valid. The other big one, of course, is PT. Physical therapy. PT stands for pain and torture. You know, so that's a big one. And sometimes I joke around with that.
Yeah.
And come into a room and say, "Yeah, I'm your pain and torture." And they know exactly what I'm talking about. They know your physical therapy,
Yeah.
and you kind of just laugh about it a little bit, and then just kind of reassure them that your goal is not to cause more pain, especially in the hospital. Most of the time, you're not going to increase pain for people. You want to try to minimize it because that gives them more confidence to get up and move.
Quick question with the concept of pain here. I hear so much back and forth of pain is good. It means that you're treating the problem versus like pain is bad and you're wanting to move away from whatever stretch or movement just caused that pain. Is there truth behind both of them, or like what does that
Oh
look
yeah,
like?
I think there's truth behind both of them. Sometimes I get people that are 2 hours out of their knee surgery. They've had their knee replaced and they'll be doing an exercise and they're like, no pain, no gain, right? And I'm like, well, you know, if you hit your head against the wall and you have pain and you just keep hitting it more, no pain, no gain,
Yeah.
that doesn't make sense. When you have a real fresh surgery, you're not always looking to cause more pain, but sometimes there's an appropriate level of discomfort that you need to move through to get the improvement. And we would encourage people to move through that pain when it's appropriate and when we understand the outcome's going to be better. Sometimes pain is there for a reason. You gotta just stop. There's times you need to lay down and rest. You need to elevate, ice. Some of these more acute injuries. We need to slow down a little bit. I would say, as a whole, we've learned that we need to be more fast with most injuries, but there's a place to avoid pain. I think um, pain's been a big topic when we start talking about recent the VA problem in our area, in the Toma area. We have a big VA system, and patients were having a lot of pain, and it seemed to be that the opioids were a great way to help people have less pain, but what they found was over time you can't get off them. It affects your body's ability within the nerve structure, and um, to get people off of it, to just remove that medication from their body, actually they end up having more pain when you take those opioids away. And physical therapy actually came in and partnered with this because we've learned movement is a big part of trying to um, manage pain and also help people learn that some movements can actually make them feel better. And so, yeah, pain is a interesting thing because in those situations we do encourage people to go ahead and keep moving, and if they continue and keep their body moving, it actually can help them get through that crisis of getting out of the opioids. And we have some certain types of guidelines to help people through that. And so, yeah, we partnered with the medical community and the whole opioid crisis and trying to help people get out of the dependency on that.
Are there some good, not good tells to for a patient to be able to understand, when a pain is bad versus when it's good, before they, have to
Wow.
call up their physical therapist in the middle of the night, like, hey,
Sure.
yeah,
Yeah, I don't know. That's a tough one. That's always a tough one because there's certain types of things that might be an indicator to get into the emergency room, right? And you don't want to be telling someone to ignore certain pains, and here they should have been getting care urgently. I think in general, if you're freshly injured, you definitely should follow the rules of rest, ice, elevate, for at least 48 hours, and don't expect to push through pain right after an injury for a couple days. Uh, is pretty safe advice. Um, hmm. I might have to get back to you on that one, Jacob.
no worries. I was just, as even as a kid, like there was always that question of like, the relativity of pain, and like, I remember at one point a family member told me, like, no, you didn't sprain your wrist. If you sprained your wrist, you'd be crying. I'm like, how do you know if I'd be crying or not? Maybe I have a
Right.
high pain tolerance. Like,
Yeah. Well, some people do. My son went through that. He had hurt his wrist, and I kind of said, "Well, let's see how it goes for a few days." And he never complained about it again. And a year later, my wife noticed his handwriting was getting worse and worse, and we started looking at him closer, and we looked at his hand and his wrist, and he just didn't have the movement that he should for his kid his age, and took him in, and sure enough he had broke it. And we looked back and thought about it. We figured that he had broke his wrist, particular scaphoid bone, and that required him to end up getting a surgery. So yeah, definitely be aware of, if something doesn't get better in a week or two, then you better get in. If you're gonna try the route of just letting something go away,
yeah,
you don't want to let it go too long, because some of these problems are easily fixed on the front end, and they become a very difficult fix later. So it's always good to get some advice on certain types of injuries, and it's hard to counsel in this type of a thing,
yeah,
this type of a setting.
yeah. And I think that's something that I've just been super blessed in, with both having, pharmacists for parents, having so many of my college, almost all of my roommates have been either athletic trainers or in the pre PT program, and have definitely counseled me when I do something stupid. They're like, "Yeah, you should." There, I just remember there was one time where I like cut my finger in a really stupid incident, and I was just gonna like, super glue it and go to bed. And my roommate came back and he just looked at it and he's like, "Yeah, you need to go to the hospital to get it stitched up." And I think part of it was like I think I subtly knew it in my head, but at the same time, the shame of like stabbing it, trying to pit an avocado, was just too much that I wanted to stay away from all of that. But it's just been, yeah, such a super blessing to be able to have all those different people in my life to be able to call up and ask these different types of questions.
Well,
Oh,
and that's an interesting thing too. Telehealth and uh, being able to contact doctors is changing quickly. They're doing more and more, over the phone consults and video consults, and
mm,
it's becoming in some respects more accessible to get to providers. We're not there yet, but I do imagine in the near future it'll be, you know, you'll have your friends, but other people out there will be able just to maybe call in and have a quick telephone consult with a provider and decide whether they need to come in more or not.
yep, which will be far better than WebMD.
Yeah,
Uh,
I hope so.
but speaking of that, though, that reminds me. So I know Wisconsin has a direct access policy where patients need to have to go through a doctor first before they can get a basically a prescription almost to see a physical therapist. Can you just talk more about like what that looks like and your views on it?
Well, actually, the state of Wisconsin does allow direct access to physical therapy. I can legally provide care to patients that want to seek me out for, um, a problem that they're having, and I can evaluate them. And you know, in those types of situations, it would be up to me to make a really good judgment call. I think legally, you'd be on the hook for a lot more if you made a bad decision in that situation. But I do think that physical therapy profession has been uniquely prepared to meet that need. The interesting thing though is if that patient wants their insurance to pay for it, each insurance might have a different policy. Most insurances and Medicare typically is requiring that a doctor would prescribe physical therapy.
Oh, okay.
So if you want to pay cash, you can go see a physical therapist, and there's nothing that would say I can't practice physical therapy. It used to not be that way. It used to be for me to practice physical therapy, I had to have a doctor write a prescription for that. Um, and in that old system, the insurance companies adopted that policy. To my understanding, they haven't necessarily all dropped that, but maybe some of them are beginning to see some of the advantages, cost savings, in that if this is really truly a physical therapy problem and I'm requiring a doctor visit first, that's an extra step.
Yep.
But that is with the expectation that all physical therapists have a skill level to recognize what things we treat and what things we don't, and to be able to say, hey, nope, this actually isn't a physical therapy problem. Now you go to the doctor, and to document that. And I would say, to me, I find a lot of comfort in the collaboration of working with the physician staff, because they just kind of serve as a foundation to the medical community. Um, I, I I'm happy that we have direct access, but I also like that backup of knowing that a physician's looked at this patient and I have someone to communicate back to. But that's where I'm at. There's a lot of highly skilled physical therapists out there that have been doing this for a while, and they're doing amazing work in the field, and progressing our openness of access, if you would say.
Yeah. It just makes me wonder even too of like having a different way to screen for that for physical therapists so that doctors aren't having to necessarily do that just to then recommend that they go to a different person. But I just remember like the couple of times that I uh, would try to go for PT, and then I'd have to like tell my tale of woe of how I injured myself to like four different people before I'd even get to like signing up for physical therapy, and that just
Sure.
um
And I still think that there is some of that, chasing around that goes on.
mm,
And some of it is the doctor probably looks at a lot of injuries and recognizes, give enough time, that's just going to be fine. You're young, you're gonna go back to playing spike ball and all your fun games, and you're gonna naturally rehab yourself because you're just living life. Um, but sometimes those types of injuries maybe don't heal up, and then you're going back to see him a second time, and then finally you get to go. Yeah, maybe that's an extra step. And I don't know what the right answer is, to be honest with you. It's I just don't think that there's ever going to be a real perfect way where we're going to get it right every time.
Yeah. Yeah. Welcome to the real world, I guess, Jake.
Yeah, there's
Uh,
a practicality.
yeah. Before we wrap up here, I just have a couple questions here to close out. First one being, as a physical therapist, what would be your ideal start to the day? Whether that's like stretches, what you're drinking, what you're putting into your body, what would that look like?
Hmm, good question. So you're asking what would be a good way for people to start their day from a physical therapist perspective to treating their body well.
Yes.
Here's what I think. It isn't that there's a best way to start the day, but maybe there's a best way to try to live each of your days. I do think that um, the way we were created was to have some routine in our life. And I do think that routine is an important aspect of it. So I do think some people, might roll out of bed and just go right to work. But maybe they have a routine of doing some exercise at some point in their day. Um, I think that having balance within your exercise routine, I'm seeing people that are trying to push themselves to their limit, getting some injuries. Um, and I'm not going to name any like types of things. I don't want anyone to get a bad taste about that. But I do think that um, people are trying too hard sometimes to make themselves healthy, and they cause injuries because they're doing extreme things.
Mm.
So I feel like I'm talking to people often about staying within the margins.
Yeah.
Um, I think the areas you might push yourself to the limit or harder on would be your cardiovascular workouts. Um, and try to expand that um, as much as possible. And then, like your weightlifting, strength endeavors are going to fall a little bit, maybe less heavy for just joint health and tendon health. But at the same time, we find that people that lift heavy weights and do strong ballistic motions actually can their bodies respond to that. Their tendons get stronger, their muscles get stronger. Obviously, right? You see these guys that are just ripped. So I think that's good, but I think life is best lived kind of a little bit in the middle. You can have some consequences when you push too hard. So if I'm trying to give best advice, I think it's your circulatory system is king. That's what brings your healing. And if you aren't focusing on good heart health and good nutrition, that's going to affect your body's ability to heal. Um, a lot of your healing happens at night when you sleep, and I see a lot of people that are not getting adequate sleep. They're staying up too late, or their sleep cycles are different every night. And then that gets back to my routine. Does that sound familiar to you, Jacob?
No. Nope. Nope.
I see you reacting as I'm saying that. So, but you talk about holistic earlier. I think more and more health professionals are recognizing that sleep is a big part of the way we're made to replenish ourselves. You hit that deep sleep. That's when your growth hormones get released in your body again. And if you're not getting good deep sleep, you really can't heal. And I find myself talking about that with patients. Are you sleeping at night? And if not, why not? And what can we do to get your sleep to happen? Because this chronic injury that you're trying to get over probably isn't getting better if you're not getting good sleep. So, yeah, perfect way to start your day and get going is to decide to have a routine, get good sleep, find a time to exercise, and then give yourself a day break every week.
Mm.
I think that's a a good way to let your body recover too. I think if you're breaking your body down every day of the week and you don't ever give yourself a day of rest,
Yeah.
that's a bad design for your week.
Yeah, it's something I've honestly been trying to practice is just taking that Sabbath day. Um and so often I feel, especially in this culture, like it's two steps forward, one step back. Or in my case, actually it's just one step forward, two steps back. And I have to reassess almost every other week to try to
That's
actually get it back into.
I don't know that there's a perfect way to do it, but um, even if you just live mindfully, um, that maybe if you can't get a whole day, maybe a couple days in a row where it's not quite as intense.
Mhm. Yeah. One of the other questions that I have here is, what is a book, show, podcast, or song that's caused you to sit back recently and reflect?
So I'll just maybe highlight a song that maybe impacted me in the last couple of years called "Together" by King and Country. So people want to listen to that, but just the idea that we can do great things together, and I do think that maybe that came through in sharing about my experience in physical therapy, how important the teams are in the hospital and your coworkers and the amazing people I get to work with every day make me a better therapist. And even in your daily life, you're going to need that group of people to help you through it. But I think that as we went through the whole COVID pandemic, that "Together" song became a little bit of a mantra in our house. My wife just absolutely loved it, and she played it a bunch, and it just really hit me uh, uh, through that time.
Hmm. Hmm. And then finally, what, looking at finally the concept of legacy and what you want your legacy to be, both as a physical therapist and as, outside of that.
Wow, it's a big question. Sure, I think maybe I think about that a little bit. I think um, I would say that within my hospital, I'm willing to say yes to things that I don't know much about and try. I'd hope my legacy would be that I was willing. Um,
Mm.
and I do think that part of that confidence to try things to some extent comes, through my faith. I think that, the Lord's give me gifts and I need to try to use them to the best I can. And so,
Honestly.
so you asked the question about legacy. Boy, that's a interesting one. I have my family legacy with my family. I put that above anything that I'll ever accomplish in physical therapy. I think about my legacy as accomplishes I may have done. I probably look at the ones outside of my work in the hospital, but within the hospital system, I hope that my legacy would be that I have cared for people, both my coworkers and served people, just not just the patients, but the people around me. Maybe encouraged and enabled people to try and to do things that they might not. I think I'm always um, trying to make sure that I'm willing, and I don't want to always be the person that the first initial reaction is. I don't know. I want my first reaction to be more of yes, but maybe we need to try to do it this way. So I think that that's part of who I am a little bit,
Mhm.
and I'm always willing to try. And I do think that it's um, been exciting to say yes to some things um, that have given me opportunities to be into an emergency room setting. I haven't had any additional training in that, but I've learned as I've gone. Um, if I waited to get some coursework, maybe the opportunity went to someone else. But that's grown. There's a lot of people doing that now in our hospital, and um, I don't know if I was the first person, but I was kind of on the front edge of that,
Mm.
just because I was willing, and also where I was working in the hospital made it convenient. So I think that would be my legacy, that I'm willing to try, both out of the hospital and in the hospital. Uh, Not afraid to take a risk here and there, even if I don't, know the outcome.
Mhm.
Um, sure. So that's
Well, awesome. Thank you. Once again, this is Paul Fisher, physical therapist. Paul, thank you so much for being on the show with us today.
yeah. Thanks, Jacob. I really appreciate it.